Everyone. In this presentation, I'll continue my talk about medical errors and will specifically discuss some medication errors. So let's get started. So let's start with the definition of medication errors, which is any preventable event that might lead to inappropriate medication use or patient harm, while the medication in control in the hands of healthcare professionals or patient themselves or consumers, whoever using those medicines. So these events might be due to professional practices, due to the product itself, or the procedure of dispensing the medicine or prescribing the medicine, or might be in the health system itself, the way it deal with these products, or even communication between anyone in the cycle of prescribing, dispensing, and using. Moreover, it might be due to the labeling of the medicine in defective way or incorrect way. It might be related to the packaging of the medicine and the way it's stored, or due to the components of that medicine or drug, or the distribution. It's anything related to medicines from the moment they are produced to the moment that the end user use them and utilize them. So anything in this channel might lead to medication errors. So what are the causes usually? Well, the causes might be related to healthcare professionals because they are usually the prescriber or they are the administrator of the medicine in such forms, injections, intravenous, and so on. So it might be related to the end user, which is a patient, or even if a healthy individual, because sometimes healthy individuals use medications or prescriptions, right? Such as vaccinations and so on. Or it's related to the work environment itself or the medicine itself. So we are trying to create that cycle and try to think about each component of that cycle to understand the leaks and to work toward fixing them. So an important element of medication error is the process or the operation of handling the medications and the process of dispensing the medicine. Part of it is related to the electronic medical records, and part of it related to other components of the health system. So all of these areas might be defective in a way and might lead to medication errors. So let's say medication error happens or about to happen, or we want to prevent that from happening. What can we do? What can we uh, provide as healthcare organizations or provider to stop that from happening or fix our health system to avoid that from happening? So there are many studies discussed the various ways of preventing medication errors. Here I gathered a couple of cornerstones in this process and we'll discuss a couple of them. So as I said, studies have explored ways to improve the quality of prescribing and utilizing the prescriptions and the medicines. That was done by experts in the field, by clinical pharmacists, and computer technologists. So all of these personnel participate in this process of preventing medication errors. So the first strategy in medication error prevention is medication review and reconciliation. And what is that? Medication review is a process of patients' medicines evaluation in order to improve the health outcomes and mitigate the drug-related problem. Because especially in chronic conditions or in patient conditions, patients will be in multiple medications. So a very important part of the prevention of medication errors is to have a professional, usually clinical pharmacist or physician with a pharmacist, review all that list of medications to anticipate and prevent errors. On the other hand, medication reconciliation is the formal process of establishing and documenting consistent and definitive list of medicines that the patient use across the transition of care. and then correcting any discrepancies or interaction between the drugs. Because sometimes you will be treating a patient, but there are other providers out of your healthcare organization also treating the patient and providing prescriptions. So as a provider, as a physician, you need to make sure that either you personally or the expert in your organization go through that list of medication and make sure that they are all safe to be used together. And this is what we mean by the reconciliation. The second strategy to prevent medication errors from happening is the automated information system or the computerized provider order entry. It's tricky. It's proved by evidence in the literature that it minimizes the medication errors, but still it holds a risk of some errors. So you need to be very cautious using that CPOE. So but definitely there is substantial evidence that support the use of the CPOE to decrease the frequency of medication errors in the patient settings. Then we have education, and no one can deny the role of continuous education for all healthcare providers to improve the safety and reduce medication errors, whoever is concerned in this process of prescribing medicines. Nevertheless, the literature supports the use of multi-component approaches to improve medication practices, including all the previously discussed strategies at once. So we need, as healthcare organizations and as providers, to make sure that we are applying these evidence-based strategies to prevent medication errors. So I wanted this presentation to be as concise and as possible. And with this slide, I will conclude today's presentation. Here, I provided the references I used for this presentation. And finally, I provide here my YouTube channel. Please take a moment and subscribe for the channel to support my work. And thank you so much for watching this video, and stay tuned for the upcoming presentation about diagnostic errors and other types of medical errors. Thank you so much, and be well.